Hello everyone. In this video, we will briefly discuss the importance of cardiac valves, how they function, and associated murmurs that can result from various pathologies. The heart produces two primary sounds, often referred to as S1 and S2. S1 is the lub sound and occurs when the atrioventricular valves close at the start of systole. The S2 sound is the dub sound and is heard when the semilunar valves close at the end of systole. When these valves malfunction, either due to stenosis or regurgitation, they can cause abnormal blood flow. This abnormal blood flow produces a characteristic sound known as a heart murmur, which can be heard through a stethoscope. Murmurs are classified based on their timing in the cardiac cycle, that is, systolic, diastolic, or continuous. They are further categorized by their intensity, pitch, and quality. Murmurs are commonly a sign of underlying pathology. First, let's discuss valvular stenosis. This occurs when the valve opening narrows, increasing the workload of the heart. The types of valvular stenosis are pulmonary stenosis, mitral stenosis, and aortic stenosis. The pulmonary stenosis is a systolic murmur spilling through the aortic second sound. Pulmonic valve closure being delayed. It is a diamond-shaped murmur and is best heard when the patient leans forward. The mitral stenosis is a low-pitch mid-diastolic rumble with an opening snap and presystolic accentuation. It is best heard at apex and left lateral decubitus. It radiates to the axilla and is best heard with the bell. Aortic stenosis. It is aortic ejection murmur beginning with an ejection click and fading away before S2. It is higher pitched at apex, also known as the Gallowaydian effect. The clinical triad of symptoms of aortic stenosis are dyspnea, syncope, and angina. The next pathology is valvular regurgitation. Here, the valve doesn't close properly, allowing blood to flow backwards. The types of valvular regurgitation are pulmonary regurgitation, aortic regurgitation, and mitral regurgitation. The first is pulmonary regurgitation, which is a soft, high-pitched murmur which ends before S1. It is decrescendo-shaped and is best heard at pulmonary area. Also, it is best heard with the diaphragm. Next is the aortic regurgitation, which is a soft, high-pitched murmur, decrescendo in shape, and diastolic murmur which is best heard at Erb's point and in leaning forward position. It is also heard best with the diaphragm. The last is the mitral regurgitation, which is a holosystolic murmur like ventricular septal defect. It differs from VSD in location and sound because this is soft sound and best heard with diaphragm. Now, with the help of an experiment, let's demonstrate normal heart sounds and various cardiac murmur.
Mitral stenosis. Mitral regurgitation. Aortic stenosis. Aortic regurgitation.
Thanks for watching.